Hello everyone, welcome to Medical Tutorials. In this tutorial, we will be discussing about osteology of scapula under the headings of Introduction, Parts, Anatomical Position, Side Determination, Features and Attachments, Ossification and Clinicals of Scapula. Features, Attachment, Ossification and Clinicals of Scapula are dealt in second part of scapula. Introduction to scapula. The word scapula is derived from Latin word scapulae, which means shoulder blade. The scapula is a large flattened and triangular bone located in the upper part of posterior lateral aspect of thorax, again second to the seventh ribs. Coming to the parts, the scapula is highly mobile and consists of four parts, a body and three processes, spinous, acromion and coracoid process. The body is triangular and thin. It consists of following features: two surfaces, costal and dorsal, three borders, superior, lateral and medial, three angles, inferior, superior and lateral. The dorsal surface presents a shelf-like projection on its upper part called as spinous process. The lateral angle is truncated to form an articular surface, the glenoid cavity. The lateral angle is thickened and called head of the scapula, which connects to the plate-like body by an inconspicuous neck. There are three processes of scapula: spinous process, acromion process, coracoid process. Coming to the spinous process, it is a triangular shelf-like bony projection attached to the dorsal surface of scapula at a junction of upper one-third and lower two-third. It divides dorsal surface of scapula into two parts, upper supraspinous fossa and lower infraspinous fossa. The spine has two surfaces, superior and inferior, and three borders, anterior, posterior and lateral. Borders. The anterior border of spine is attached to the dorsal surface of scapula. The lateral border of spine bonds with spinoglenoid notch through which the passes of suprascapular nerve and vessels from supraspinous fossa to the infraspinous fossa. The posterior border of spine is also known as crest of spine. Acromion process. It projects forward almost at a right angle from the lateral end of the spine and overhanging the glenoid cavity. Its superior surface is subcutaneous. It has a tip, two borders, medial and lateral, and two surfaces, superior and inferior. The medial and lateral borders of acromion continue with the upper and lower lip of the crest of the spine of scapula. The superior surface is rough and subcutaneous. The inferior surface is smooth and related to the subacromial bursa. The coracoid process is like a bird's beak. It arises from the upper part of head of scapula and bends sharply so as to project forward and slightly laterally. Anatomical position and side determination. The side of scapula can be determined by holding scapula in such a way that the glenoid cavity facing laterally forward and slightly upwards at an angle of 45 degrees from the coronal plane. The coracoid process is directed forwards. The shelf-like projection spinous process is directed posteriorly.